How to recover from post-concussive syndrome. During this, we are going to discuss one, could you still have post-concussive syndrome? I get it. A lot of you are told, well, it's 6 months, a year, 2 years down the road. You sure it's not something else, because it shouldn't be impacting you. We are going to look at that. Next, we are going to look at what are the symptoms of post-concussive syndrome. We're also going to look at what should be evaluated when you are looking for help so you can make sure you actually get in the right place. And we're going to show you partly what that evaluation looks like. And lastly, we're going to dive into the complexity of treatment and what you should really look for, not only in the evaluation, but also what type of experience should you look at for a provider to help you. Now, we're going to start off very research heavy because there's enough research that we don't have to go purely off opinion. So let's get going on that. Now, the very first research study we are going to look at is, hey, you know what? Can it still impact people, right? It used to be believed that maybe 10% of people would have ongoing concussion issues. And if they did, it was likely due to mental health. Well, this study is called post-concussive, longitudinal study of post-concussive syndrome. Not everyone recovers. What they did was they did a survey to see where people were at. Now, the very first thing we're going to look at is based upon those who responded. Now, we are going to go into deeper research, but of those who responded, you see all these gray. So these are the people who did not feel they had recovered. And we see basically at the 1 to 2 year mark, the amount of people who just recover goes down. 2 to 3 years, pretty much no one. So the likelihood of a spontaneous recovery isn't very good, especially when it gets out. So what does that mean, right? It's not going to magically go away one day, even though people are told that. Next, we want to say, okay, well, we know that, and we will dive into that a little bit more. But what are some of the symptoms people have? Because I get a lot of people who come in, they ultimately are dealing with post-concussive syndrome, but they are chasing the symptoms: headaches, difficulty concentrating, put on Adderall, Vyvanse, fatigue. Oh, maybe it's my thyroid. Maybe it's my hormones. Brain fog. Oh, maybe it's the food I'm eating, right? Head pressure, light sensitivity, memory, mood issues, neck pain, chiropractic, physical therapy, right? You see, there's a lot of things you can chase because there are a lot of symptoms that occur. And it's why you've got to make sure you get the right evaluation, which we will talk about. So you really hone in on the right place. All right, so there's that one. Next, longitudinal study following recovery of traumatic brain injury. They looked at 1, 3, and 7 years. In this study, what they found when we look at the conclusion in this study, post-index TBI was associated with worse symptomatology across outcome domains at 1, 3, and 7 years. So once again, right, the worse it is initially, the greater likelihood, but you still don't have to lose consciousness, which brings us to this next one. Those with a MTBI, concussion is the most common type. Where were they at, right? So we look at 6 months after the injury, 44% had functional recovery and 56% had incomplete recovery. So at 6 months, over half still had not recovered. So, okay, well, we know the first study was a survey, but hey, you know what? Turns out people just aren't recovering. And there's other research that looks at a year. It's basically 50% as well. Now, here's this one here, right? Okay. More than 50% of the TBI sample, including greater than 50% of each the mild, moderate, severe TBI sample. So this isn't, yes, moderate, severe, bleeds, fractures, stuff like that. But even mild where normal imaging continue to endorse 3 or more symptoms as worse than pre-injury through 12 months post-injury. So can you still be dealing with ongoing symptoms from a concussion or MTBI 6, 12 months or longer down the road? The answer is absolutely yes. Okay. So now that we've established you can have those issues, well, what should you actually be looking for in an evaluation? This comes from 2023, the American Congress of Physical Medicine and Rehab diagnostic criteria for MTBI. We need to be more in the evidence-based space. I understand we don't have all the evidence we need, but where we do, we should use it, right? So There's criteria for diagnosis. Now, part 4 is the clinical examination and laboratory findings. So what does that actually look like? So we're going to head down here where they talk about what are those symptoms that you may have: confused, dazed, disoriented, headache, nausea, dizziness, balance problems, vision problems, sensitivity to light, noise, feeling slowed down, mental fog, difficulty concentrating, memory problems, emotional inability, irritability. Now, these symptoms may be from one or more categories, i.e., experiencing 2 symptoms within a single category is sufficient. Now, this is a big mistake that people make, is they will say, well, you don't have enough symptoms. Well, it turns out you only need 2. You need 2 symptoms plus the right clinical examination and lab findings. What is that clinical examination? Cognitive impairment on acute clinical examination. Now, I get it. Lots of people are doing computerized tests, doing neuropsych evaluations. Do not make this everything. It is not a complete evaluation. Please do not. Balance impairment on acute clinical examination as well. Now, balance can still be off months, years down the road. Cognition can actually normalize. Oculomotor impairment or symptom provocation when doing the testing. And lastly, elevated blood markers. Now, even though the FDA has recently improved blood markers for this, it's not for concussion, it's for things beyond that. So we need to be very clear on what it is, what it's not. So, well, what should that testing look like, right? University of Kansas, they put together actually what I consider pretty good. We use more technology than they use, but that's okay. We should use as much technology as possible, I think. But they look at pre-existing stuff that can set people up, right? Anxiety, depression, migraines, prior concussions, sleep issues, and so much more. They look at a blend of eye movement tests. They look at cervical-based issues because that can impact it. They look at balance. Now, when we look at balance, it's important to know that balance usually, right, it's not saying, okay, you're clumsy, you're tripping, you're running and stuff. We're just saying, how is your balance when you do feet fairly close together, eyes open, eyes closed, firm surface, and so forth. Now, when we look at the study, long-term effects of MTBIs includes a higher dependency on visual inputs to control vertical posture. So consistent with our hypothesis, the results reveal that balance behaviors of patients with MTBI deteriorate more abruptly in the absence of visual inputs when compared to controls. So what does testing results look like? So I'm going to show you some of the testing that we do. There's other computerized tests out there, but ideally you should have computerized tests. Okay. Yes, there are some that are really expensive and it requires the providers to make quite an investment to do, but then there's others that really aren't that much for the provider to do. So when we look at this, we see standard. This is eyes open on a firm surface. Okay. Proprioceptive, this eyes closed on a firm surface. Vision, eyes open on a balance pad. Vestibular, eyes closed on a balance pad. This is the one that matters the most. The initial is where they were at baseline. Here's where they were at after care. Drastically better. First, hey, you were dealing with it. Now, as you've improved, you aren't dealing with it anymore. So that's what it looks like. And just balance pad, right? Just something like this. Okay. Yes, you can look at it, but once again, let's be as objective as we can. All right. So we've got that. Eye movements we've talked about is a big issue. So I'm going to show you results from an eye movement. Once again, no offense to those doing stuff like this. Okay. Great on the field, but we have enough technology. We can do better than that, and we should. You deserve better than that when you're looking for help. So this is someone who's looking straight ahead. The target doesn't ever move. So you want to say, are their eyes nice and still, or are their eyes shifting left and right? And what you'll see is their eyes are shifting left and right. This is what we call square wave jerks. There's a certain amount that's acceptable, and then there's an amount that's not. Even though if you want to be picky, you could argue, is the current acceptable amount too much? But it says no surprise that this individual struggles with fatigue, brain fog, headaches, fuzzy, blurry vision, focus, concentration, and so much more. Next, what I want to show you is this is them tracking a target left and right. So the dot's just moving nice and smooth. So we want to say, okay, if the dot's moving nice and smooth, well, how well are they doing with that? Yeah, you'll see this is anything but nice and smooth. So I want you to start thinking about this, right? You're dealing with post-concussive issues. We've said it could still be an issue. We've talked about how to start looking for an evaluation. Have you had this testing done? Be honest, right? Not just some basic stuff. Have you had higher level objective testing done? In my experience, over 99% of the patients I see have never had this testing done, no matter what level of a so-called concussion clinic they go to. Okay. And really, there's no reason not to have this done. It should be done. You wouldn't diagnose a broken bone without an x-ray. You shouldn't be diagnosing a concussion without using higher level testing. I understand screening for it without, but you know, let's use the technology. We've got it. Technology allows us to have better before and afters. It allows us to more accurately see where you're at, because when you are better, this becomes your new baseline moving forward. And you need to know where you're at. So this one, they were just tracking the target moving up and down. Dot was moving nice and smooth. As you can tell, not nice and smooth. Left and right, right zigzag movements, diagonal, however you want to describe that, but definitely not normal. Okay. So next, what I want to do is we're going to talk about why most people are not getting better. Now, first off, for a lot of you, it really is you've never had a good evaluation. You cannot rush it. There are times where you can do short strep throat, but you cannot rush something like concussions. So this one, we are going to look at a research paper called The Dynamics of Concussion. And this is what happens from the time you have an impact. There's this cellular changes from blood-brain barrier permeability, inflammation of the brain, energy imbalance, blood flow issues, mitochondrial dysfunction, energy, right? Those need to be treated, right? We also have balance gate issues, right? So we've talked about that, but then we have the other side. Those who do not understand concussions, they try to make all of treatment one of these. It doesn't work, right? So the hyperbaric people, the neurofeedback people, the I'm going to supplement you to death people. Well, don't get me wrong, right? I love hyperbaric. I love supplements. I love that stuff. It's not a one trick pony. There's nothing here that makes it that easy. Usually, those people who are doing it, they don't actually have training and they don't understand what's truly happening in the brain with concussions, and it hurts people. I've also seen a lot of people who are trying to jump into the concussion realm and treat patients who have never studied concussions. And it's really scary because people don't get better, and then they think there's something wrong with them when it's actually they just didn't get the right treatment. Make sure you find someone who's been doing this, who has experience with this. And this framework helps you find someone with that experience. So I've been doing this for over a decade. Concussions are by far the most common thing I work with. It's not something new. It's something I live in. So I apply research, but also the clinical expertise, what I've learned throughout that time. So I hope you found this information useful. I'm Dr. Zimmerman. I'm known as the Brain Guy. Please, what comments, questions do you have? Let me know. I'll be doing other videos in the future on other things with brain injuries, long COVID, dizziness, strokes, brain fog, and much more. But it really does start with the evaluation. When you find proper evaluation, that is a roadmap to get better. So, till next time, it's Dr. Z.